All right, we're good to go. Hello, bonjour. My name is Jody Jollimore, and I am the Executive Director of CATI, Canada's source for HIV and hepatitis C information. Today, we're standing here in Toronto on the traditional territories of the Mississaugas of the First Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Huron-Wendat people, which is now home to many diverse First Nations, Inuit, and Métis people. As a pan-Canadian organization, CATI also delivers outreach and education to Indigenous communities across this country, also known as Turtle Island. I bring this up not just as a land acknowledgement, but also to contextualize the announcement that will be made today. Today, we'll be talking about health initiatives for people who use drugs, including overdose prevention and response, and broader health promotion. And it's important that we acknowledge the role of colonization and how it's placed Indigenous people at greater risk for drug poisoning, overdose, and poor health. This has been done through historic and ongoing displacement and destruction of languages, families, cultures, and Indigenous ways of healing. So when we talk about initiatives to promote the health of people who use drugs, we must remember that this is not just a good thing to do. For those of us who are settlers on this land, this is one small part of our duty to deliver on commitment to truth and reconciliation. It's my pleasure this morning to introduce our first speaker, the Honorable Carolyn Bennett, Minister of Mental Health and Addictions and Associate Minister of Health. Minister Bennett was first elected to the House of Commons in 1997 and has previously served as Minister of Crown Indigenous Relations, Minister of Indigenous and Northern Affairs, and Minister of State for Public Health. Minister Bennett is no stranger to CATI or other organizations engaged in harm reduction. She's been a longtime supporter of evidence-based health policy around drug use. Her support for people affected by the drug poisoning and overdose crisis is no doubt informed by her experience as a family doctor, where she saw many health concerns as a symptom of traumatic experiences during one's formative years. Helping people to recover from these traumatic experiences calls for compassion, not punishment. This is why I'm so grateful to see someone with her experience and understanding in a role as important as the newly created Minister of Mental Health and Addictions, a role that is tasked with facing one of the most pressing public health crises facing Canada today, the drug poisoning and overdose crisis. To tell us more about this and the Government of Canada's response, I'd now like to introduce and call to the lectern the Honourable Carolyn Bennett.
Thank you, Jody. Merci, McWitch. I too would like to acknowledge that as we are gathered here on the traditional territory of the Mississaugas of the Credit, where we honor all of the Indigenous people who paddled these waters and whose moccasins walked these lands, and how here in Toronto, it's just a little bit easier because of these beautiful diagonal streets that went between the waters and remind us of the people who were here first. But I think in this day and in us understanding that somehow what I learned in medical school in terms of the medical model was a little bit distant from what we are all trying to do. That, you know, even Tommy Douglas had said that waiting for people to get sick and patching them up doesn't actually make sense, and that we want to achieve the balance of the medicine wheel physically, mentally, emotionally, and spiritually, and to achieve that balance, and it means we'd rather people didn't get sick. And today we want to make sure that people don't die. And it is, je tiens à remercier Jason Altenberg, directeur général du Centre de santé communautaire de South Riverdale, pour sa présence parmi nous et pour tout le travail qu'il a accompli afin d'améliorer les résultats en matière de santé pour les communautés à risque de Toronto. It's great for CATI to host us here, and thank you, Jody and Melissa, and it has been such an important source of information of HIV and hepatitis C, and for hosting us today. And it was, I think, for all of us sort of on the front lines of HIV/AIDS. I remember when that quite often the patients do more than we did as physicians. They brought us the information. They told us, they were positive, that this was a very humbling time for all of us, and the need to actually deal with the epidemic. The idea that there would be an organization like Katie that would be that knowledge exchange, that would be able to get the most recent evidence out to the people who needed it. I think many times I've said about Katie, if it didn't exist, we'd have to invent it. And that it is about people having the autonomy to make informed choices and about their health. And I think that we are so grateful in terms of really, when you think about those early days, that I was in Little Jamaica because in my job of trying to expand the understanding of what is the mental health workforce, you have to drop into barbershops and find out what's happening there. And it was very interesting that Courtney Betty told me in the early days of AIDS that they would close some of the barbershops. They'd all meet in one, and then they'd try and get the information out around prevention and protection and all of those things. And I just think that now, as Jody said, that through all across this country, there is now a network of people who are getting trusted information from Katie in their very limited resources in rural and remote places, and that the kind of really excellent material in many languages is there as a trusted source of getting. And I hadn't really thought of it before, but when you think of all the mis and disinformation that's out there, people do need a trusted source where they will be able to believe what's written and be able to share wise and evidence-based information with their friends and the people they care about. The tragic and overdose and toxic drug crisis continues to exact this deadly toll in this community and all across Canada. I think to think of what 30,000 people who've died since 2016, that's 30,000 people. That this is unbelievable when you think of actually how many, not only sons and daughters and fathers and mothers and co-workers, but how that ripples out into the kind of hurt that it is for those that are left behind, the people who worry they could have done more, worry that was there something they could have done or said that would have changed that deadly outcome. L'Ontario n'est certainement pas à l'abri de cette tragédie, car c'est la province qui a le deuxième taux le plus élevé de décès par surdose d'opioïdes et qui a perdu plus de 4,000 vies au cours de 2 dernières années seulement. With so many lives at risk, we must prioritize the bold policy change and the full continuum of supports to help people who use substances and save lives. And as Jody said, that this starts with compassion. It starts with the idea that you can't help people who are dead. We have to help people on their journey, and that the compassion that comes with understanding the role trauma has played in so many of people using drugs. It may be physical trauma, as a roofer who's fallen off a roof and ends up with medication, and then it gets cut off and they go to the street to be able to deal with their pain, or the psychic trauma of someone who was abused as a child and hasn't found a safe place to be able to talk about that pain. That this is where the compassion has to begin, and it has to continue as we realize that what trauma-informed care means is that we have to stop asking what's the matter with that person and begin that conversation of what happened to that person. And so that we can more easily demonstrate our compassion and be able to establish the kind of that first trusting relationship that actually helps somebody on their path to a safer and better life. So it means that the full continuum has to include, obviously, prevention and treatment, but it has to be harm reduction, which unfortunately some of those speaking loudly about this area don't seem to understand. And as we continue to say that there is no recovery for someone who is dead, that we actually know that, and that no matter how many treatment beds there are, if you cannot get people in that moment with a trusting relationship with it, we'll say, where's the Suboxone lady, or where is, in that moment is the moment that we can help. But until that moment, and if you let that moment pass, that we will continue to have this deadly toll. So as Jody said, people who use substances need support, not judgment. They need community, not isolation, and they need empathy and understanding, not stigma. And so one of the bold policy changes our government has taken to address the overdose and toxic drug crisis is the granting of the exemption to British Columbia to allow adults 18 and over found with up to 2.5 grams of certain illegal drugs for personal use no longer have their drugs seized or arrested or criminally charged. This exemption came into effect in January, and we are very intentional and diligent in being able to track the public safety as well as public health data as we continue to evaluate this British Columbia approach. As also part of the report is supporting community-based projects led by amazing organizations like our host, Katie. Ces organisations sont profondément enracinés dans leur communauté, bénéficient de la confiance de leurs clients et possèdent les connaissances de première main nécessaires pour faire une réelle différence dans la vie des gens. So today, this is the drum roll time. The government is announcing over $7 million in funding for 8 innovative community-led projects across Ontario. These projects, funded through Health Canada's Substance Use and Addictions Program, will help to improve health outcomes for people who are at risk of experiencing substance-related harms and overdose by scaling up the prevention, harm reduction, and treatment efforts, including access to safer supply programs. This investment is part of our broader commitment to make quality treatment, prevention, and harm reduction services more accessible to everyone who needs them. Safer supply programs, increased naloxone access, increased options for opioid and agonist treatment, drug checking technologies, supervised consumption sites are essential elements of the comprehensive approach we are taking with our partners. Nous travaillons également avec les provinces et les territoires sur un système de soins multidisciplinaire, transformateur, qui intègre des soins de santé mentale et de dépendance centrés sur la patient, tenant compte des traumatismes et culturellement pertinents dans notre système de soins de santé universel, afin que personne ne soit laissé pour compte. From increased access to mental and substance use services through primary care, to improved data and better sharing of health information between providers, tailor-made bilateral agreements with provinces and territories will improve the access to the supports that Canadians need when they need them. This also will reduce substance use harms, prevent an overdose, reduce stigma, and help save lives. We are committed to continuing to work with all orders of government, stakeholders, people with lived and living experience of substance use, and organizations such as yours to develop bold and comprehensive drug policy and programs that will save lives and ensure that all Canadians are supported on their journey to become their best possible selves. Ensemble, nous mettrons fin à cette crise. Thank you again. Merci, miigwech.
Thank you, Minister. And I'm going to go off script for a second and just say, I don't want to take for granted your visit here today. There was a time when politicians refused to meet with HIV/AIDS organizations, when we couldn't get ministers and government through the door, let alone dedicated funding. So thank you for being here, and thanks to your government for your support. I'm Jody Jollimore. I'm the Executive Director of CATI, Canada's source for HIV and hepatitis C information. Before I start to talk a little bit about the funding, I'd like to ask for a moment of silence for the 32,000 Canadians who've died of drug poisoning and overdose since 2016. That's 32,000 Canadians who died of an opioid toxicity between January 2016 and June of last year. These are our friends, our family members, our co-workers. For many of us in this room, a loved one is included in that number, myself included. In the most recent reporting, we've seen approximately 20 deaths a day. By comparison, this is more than 5 times higher than the number of AIDS deaths at the peak of the crisis in 1995, a crisis that pushed all levels of government into action, which propelled organizations like CATI to the forefront of Canada's response to HIV and AIDS. Harm reduction is not a new issue for CATI. Since the 90s, we've recognized that the most effective way to prevent HIV and Hep C is not to prevent drug use, but to give people who use drugs the information and tools they need to prevent harm and to promote their health on their own terms. Needle and syringe exchanges, distribution programs, and supervised injection sites helped to bring HIV and hepatitis C rates down among people who use drugs and connected them to community-based and social services. But in recent years, another threat has emerged for people who use drugs and their service providers. Ce qu'on appelle souvent une crise des opioïdes ou une crise des surdoses, nous préférons ici à appeler une crise de la contamination des drogues. Il n'y a pas que des surdoses, il y a aussi des décès sans précédent dus à des changements dans l'approvisionnement en drogues illicites qui entraînent des doses imprévisibles et mortelles. On aurait pu empêcher chacun de ces décès. Minister Bennett was once quoted and has said it again today, there's no path to addiction recovery for people who are dead. With the growing overdose crisis, we felt something similar here at CATI. How can we be promoting the health of people who use drugs without addressing the greatest threat to their lives? This is what prompted CATI's expansion from an organization focused on HIV and hepatitis C information to one that also provides broader health information relevant to people who use drugs, including overdose prevention. Nous y sommes arrivés grâce au programme sur l'usage et les dépendances aux substances, ou PUDS, du gouvernement du Canada qui nous versera plus de 300 000 $ sur 2 ans pour intégrer les dernières données et les pratiques exemplaires issues de l'expérience de première ligne et de la recherche. Nous aiderons ensuite à mettre ces connaissances en pratique pour sauver des vies et promouvoir la santé. This funding will support Katie to work with people who use drugs and frontline service providers across Canada to create and distribute bilingual print and online resources, to synthesize the latest evidence on the optimal distribution of safer drug use equipment, sorry, folks, to deliver English and French webinars for service providers on evolving models of supervised consumption services, and to publish resources for service providers on the broader health of people who use drugs beyond HIV and hepatitis C. We are grateful for the Government of Canada's support, for Minister Bennett's visit and commitment to addressing not just the response to the drug poisoning crisis, but also to changing policies to address the root causes, such as alternatives to the illicit drug supply. On behalf of Katie and the people whose lives will be saved by this funding announcement, I'd like to extend my deep appreciation to the Minister and the government. And to speak to some of Katie's work and partnerships, I'd like to invite our next speaker, which is the CEO of the South Riverdale Community Health Center, Jason Altenberg. Jason.
Thank you, Jody and Minister Bennett. It is a real honor and pleasure to be here with you today, Minister Bennett and Jody, with your team at Katie. And I want to start also by extending a thanks to Minister Bennett and the SUAP program for supporting compassionate, innovative, and essential life-saving services that are filling gaps, that are policy gaps and program gaps that communities have been calling for change for decades. And it takes courage to make these changes, policy changes and program changes, in a way that is surprising to communities, because it's common sense to communities. And I do think that being here to speak with colleagues from Katie today is important, because the role of bringing expertise to the discussion, and a diversity of expertise that includes science, but also includes the expertise of people with lived and living experience, the expertise of frontline workers like harm reduction workers that work in programs like mine, doing that in a way that does really high quality, deliberate dialogue to move through our differences is something that is extremely rare and essential in the moment we are in. And so I am pleased that Katie will be expanding its role as a very trusted partner to community harm reduction programs like ours. Your work has amplified the voices of people with lived and living experience, as well as scientists and evidence, as well as frontline workers, and that means a lot. It's been said by both Minister Bennett and Jody that the deaths in Ontario and across the country continue to be a major humanitarian and public health crisis. And while there's been some stabilization in the last year and last months as COVID has stabilized in a way, where we are is still much worse than we were before COVID. And that isn't changing. And in Ontario, we've seen that safer supply programs that we are one of the beneficiaries of the funding from SUAP for are serving in excess of 1,500 clients on a daily basis right now, and providing life-saving supports to people who otherwise have been failed by a treatment system that doesn't meet their needs. And it's not because these people don't want those services. Those services don't work for everybody. And so we're in a time where the evidence is changing, the experience of people on the ground is changing so quickly, and our practices and policies have been slow to keep up. And so the need for courage and innovation is unlike it's ever been in terms of harm reduction and overdose response. And safer supply programs require committed and ongoing funding to expand their reach. And frankly, programs like SUAP have given us a lifeline at a time where not all provinces have decided that they're willing to step in and provide these life-saving services to people in their provinces. So I'm deeply grateful, and I know programs across Ontario are deeply grateful for the ongoing support from the federal government, because we know that there is so much more that needs to be done to prevent these preventable losses of life. And today's announcement is welcome news and a lifeline to our programs and to the people we serve. So thank you very much. Thank you.
Thank you, Jason. Thank you, Minister, Katie staff for coming out today. That's the end of our speaking portion, and I'm going to hand things over to Lori. Thanks.
Thank you. Merci. We'll begin the Q&A portion by asking if there are any questions from the media here in the room. Nous allons commencer avec quelques questions ici dans la salle. No. Okay. Alors, there are no questions here in the room, and il n'y a pas de questions ici dans la salle. So we'll pass it to the Zoom for any questions. Nous allons passer à Zoom maintenant pour les questions.
Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. We will now proceed to questions from journalists online with Zoom. If you're a reporter and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Dernier appel pour des questions sur le Zoom. Last call for questions on the Zoom. There's no questions on the Zoom, so back to you in the room.
Okay, well that concludes today's event then. Thank you. Ceci conclut l'événement aujourd'hui. Merci.
Thanks, everyone.